DelGrosso, and then going to his left. So this question. Although the Center for Disease Control ranked Colorado as the healthiest state in the country, in terms of mental health, our record is remarkably different. Colorado has the 7th highest rate of suicide in the country. It was back in the news today with one of the Broncos players committed suicide yesterday. Is ranked 31st in per capita spending on mental health treatment, according to the National Alliance of Mental Illness, and is ranked last in per capita spending on substance abuse prevention, according to the National Center on Alcohol and Substance Abuse. The largest inpatient mental health treatment facility in our community has become our county jail, and we are forced to transport individuals to Greeley for detox and acute treatment facilities. So what are your thoughts on how Colorado and the county are currently allocating resources to address these issues, and what, if anything, would you do to address funding for mental health and substance abuse treatment?
Thank you. Yes, definitely mental health and substance abuse issues are definitely hugely important to our community. When somebody has a mental illness or a substance abuse issue, it doesn't just affect that individual, it affects their family and it affects the entire community around them. The way that I view mental health and substance abuse things is these are an investment that we can, when we provide services that help these individuals out, is that is an investment in our community. We have to, the reality is somebody, if they have a mental issue, illness, or if they have a substance abuse problem, is we're going to spend money to help this person, whether sooner or later. So we have to ask ourselves, do we want to spend the money up front and maybe help these individuals out in the community level, or do we want to spend more money down the road and more hospital beds and more prison beds? And so that's one of the main questions that we have to ask ourselves. So I personally do feel that funding issues like mental health and substance abuse programs definitely needs to be a high priority at the state level, because that is an investment in our communities, and it does save us millions of dollars down the road, not including even a social cost when families break up and they have problems with their kids and people drop out and we have homeless rates go up and all of that stuff. Now to the question as far as funding, it's no secret mental health has definitely been cut by millions of dollars the last couple of years. They have definitely seen a huge strain on there, but we need to work on a state level as far as to try to actually, a lot of these folks have dual issues. They have both mental health issues and substance abuse issues at the same time. So maybe we can work to break down a lot of the barriers to let these folks get treated at the same place, so they can get treated for their mental illness and this substance abuse program at the same time. So it's kind of a one-stop shopping instead of you have to go here and then you have to get treated here, and the treatment is definitely a lot less effective. Now, one of the steps that was addressed for funding mental health this last year was addressed at the legislature in the medical marijuana bill, is some of the sales tax that will be collected off of the medical marijuana will now be allocated towards mental health and substance abuse. So there are several folks down there at the legislature that are putting mental health high on their radar, and they're looking at different ways that we can backfill some of this money that's definitely been taken out. But definitely funding mental health issues and substance abuse issues is definitely an investment in our community, and providing those dollars up front saves us millions of dollars down the road.
Mr. McCreary?